Hello everyone, welcome back. So today we will be continuing our second chapter's questions, that is permanent dentition from the oral anatomy. In the previous video we did 20 questions from this chapter, and now we will be continuing from question number 21. Okay, so let's begin. Which of the following is the smallest posterior tooth? So its answer is mandibular. Its answer is B, mandibular first premolar. Okay, mandibular first premolar is the smallest posterior tooth. Question 22. The permanent anterior tooth which is most commonly atypical is. So its answer is maxillary lateral incisor. Maxillary lateral incisor is the permanent anterior tooth which is most commonly atypical. Question 23. Tooth with smallest root is. So its answer is mandibular central incisor. Mandibular central incisor is the tooth with the smallest root. Okay. Question 24. Number of roots in maxillary second molar. So its answer is 3. Maxillary second molar contains 3 root. इसका जो explanation है वो भी देख लेते हैं. Maxillary second molars have 4 well formed cusps and 3 roots. Okay. Now question 25. In comparison to maxillary central incisor, maxillary canine has a height of contour that is. So its answer is A, more. So in comparison to maxillary central incisor, maxillary canine has a height of contour that is more. Question 26. A maxillary right canine may be distinguished from a maxillary left canine because. So its answer is the distal half of canine shows more convexity than the mesial half. Okay. So in this way we can distinguish maxillary right and maxillary left canine. Question 27. Single central pit is formed on occlusal surface of. So its answer is mandibular second premolar. Mandibular second premolar contains single central pit on the occlusal surface. Question 28. Which of the following features of a permanent maxillary lateral incisor aids in distinguishing it from a mandibular lateral incisor? So its answer is more pronounced lingual fossa. Let's see its explanation. In the maxillary lateral incisor, the lingual fossa is more pronounced with developmental grooves. Its mesio-incisal angle is sharp, whereas disto-incisal angle is rounded. The lingual surface of mandibular lateral incisor is marked by the absence of developmental grooves with little pronounced cingulum and lingual fossa. Both the mesial and distal incisal line angles are sharp. Now question 29. On which of the following permanent teeth is it most difficult to distinguish between mesial and distal aspects? So its answer is B, mandibular central incisor. Mandibular central incisor is a permanent tooth in which it is most difficult to distinguish between mesial and distal aspects. Let's see its explanation. The mandibular central incisor is bilaterally symmetrical when viewed labially and incisally. The mesial and distal incisal angles are very sharp, and the mesial and distal outlines of the crowns make a straight drop downwards. The incisal ridge is straight and is at right angle to the long axis of the tooth. Because of all these features, it is difficult to distinguish the mesial and distal aspects of the mandibular central incisor, and so the right and left central incisors are difficult to identify. Okay. Now question 30. Mesiolingual grooves may be found on which of the following permanent teeth? So its answer is mandibular first premolars. Mandibular first premolars contain mesiolingual grooves. Question number 31. Cusp of carabelli is present on which surface of the permanent maxillary molars? So its answer is option D, mesial half of the palatal surface. Question 32. Difference between mandibular and maxillary premolars is that in the mandibular premolars, options are the buccal and lingual cusps are more prominent. Option B, the lingual cusp is sharper and longer. Option C, the lingual surface rounded and less developed. Option D, the buccal surface is rounded and less developed. So its answer is C, the lingual surface is rounded and less developed. Question 33. Upper 4 resembles 5 from which aspect? So its answer is B, lingually. Let's see its explanation. From the lingual aspect, little variation may be seen between 4 and 5, except that the lingual cusp of second premolar is longer, which makes the crown longer on the lingual side. Okay. Now question 34. Largest permanent tooth in the mouth usually is? Answer is maxillary first molar. Maxillary first molar is usually the largest permanent tooth. Maxillary first molar is the largest tooth in the permanent dentition. In mandibular arch, permanent first molar is the largest tooth. Question 35. Largest tooth in the mandibular arch is? Answer is permanent first molar. We have already seen its explanation. Question 36. Longest tooth of the maxillary arch is? So its answer is permanent canine. Longest tooth. Okay, it's permanent canine. Now question 37. Number of cusps in mandibular first molar is? Answer is C, 5. Mandibular first molar has 5 well developed cusps, 2 buccal, 2 lingual and a distal cusp. It has 2 well developed roots, 1 mesial, 1 distal and 3 root canals, mesiobuccal, mesiolingual and distal. Occasionally a 4th canal is present in distal root. Question 38. Which of the following has a bifid root? So its answer is C, 3-4 and 4-4. Mandibular first premolars, both left and right, have bifid root. Question 39. Rounded protuberances on the incisal edges of newly erupted permanent incisors are? So its answer is mamelons. Option A, mamelons. Permanent incisors develop from 4 lobes, 3 labial and 1 lingual. The lingual lobe is represented by the cingulum and 3 labial lobes terminate incisally in rounded eminences called mamelons, which are prominent in newly erupted incisors. Question 40. Oblique ridge in maxillary first molar joins which of the following cusps? So its answer is options are distolingual and distobuccal, B, mesiolingual and mesiobuccal, C, mesiolingual and distobuccal, or D, distolingual and mesiobuccal. So its answer is option C, mesiolingual and distobuccal. Oblique ridge is formed by the union of triangular ridge of distobuccal cusp and distal ridge of mesiolingual cusp. The oblique ridge is reduced the level of marginal ridges at the center of occlusal surface. Okay, so 20 questions of this chapter are done in this video. If you like this video, if it is helpful to you, please do like and subscribe. Thank you so much.